Good afternoon. My name is Kendra White, and I am the Senior Manager of Community Relations for UPMC for Life. Today, we will be having episode 3 of our Staying in Touch series, Resolving Family Conflicts. The Staying in Touch series is here to help you stay connected and informed during this challenging time. We are happy that you've taken the time to join us and hear from some of our experts in the fields of preventive medicine, mental and physical health, and other specialties. We'll keep you today for about 30 to 45 minutes, and before I introduce today's presenter, I want to start with a quick poll question for our listeners. On your telephone keypad, you can press 1 for yes or 2 for no, and the poll question is, do you regularly hold meetings with your family to talk about problems? Press 1 for yes, press 2 for no. And if you're on the online version, you will have an option there to vote. You'll see where it says new poll question, and you can vote yes or no there as well. And I also want to let our audience know that if at any time you would like to ask a question for our presenter, you can press star 3 on your telephone keypad to be connected to someone on our team who will take your question. If we do not get to answer your question on the live call today, we will be given a log of these questions that will enable our team of professionals to follow up with you. Any specific questions regarding COVID-19, we ask that you can refer to our website at www.upmchealthplan.com/COVID. Again, that's star 3 to ask a question if you're dialing in today. If you're joining us via the online forum and decide to type in a question, please provide us with your name and an email address or phone number next to your name so that we are able to respond to you after the meeting. And without further ado, I'd like to introduce our presenter today. His name is Dr. Jack Kalon. He is a Senior Director for Integrated Clinics, Telehealth, and Community Liaison at UPMC Western Psychiatric Hospital of the University of Pittsburgh Medical Center. He's also Clinical Assistant Professor of Psychiatry at the University of Pittsburgh School of Medicine. And Dr. Kalon has oversight of integrated clinics that include Centers for Counseling and Cancer Support at UPMC Hillman, Behavioral Health Services at UPMC Primary Care Clinics and UPMC Women Care Clinics, as well as UPMC Center for Integrative Medicine at Shadyside. He received his bachelor's from St. Francis University and his master's of social work from Catholic University of America. He also has an MP, a master's of public health, and a PhD from the University of Pittsburgh, and has co-authored a manual on coping with mental illness for families, co-authored a chapter in the Handbook of Marital Therapy, and has co-authored numerous journal articles on cognitive therapy. So we welcome you today, Dr. Kalon. You have quite a resume of experience with this topic, and I'm looking forward to hearing all that you have to say today about this topic. It's a very interesting one, to say the least. Welcome.
Thank you very much, and thanks for joining me today. We're all accustomed to having routines in our family and planning for the future. We plan for work and school activities. We plan for holidays, for doctor's visits, religious observances, for sports, senior activities. We plan for lots of things as a family. The recent events requiring us to stay at home in close quarters with family members is something we never imagined would happen. And there was no time to plan for this. It happened much too suddenly, and we were forced to adapt with very little planning. I'd like to talk today about some things that you can do to help understand why we're struggling with this, and really some ideas about how to understand and manage and cope with the situation we're dealing with now. We all like to have control over our lives. This is a situation with the fear of the virus, as well as being confined, that we can feel lots of things are out of our control. And in reality, there are a lot of things that are out of our control. Typically, when we feel a situation is out of our control, the normal conflict between family members can increase. Same thing when people live in confined spaces. We can get on each other's nerves. And to some extent, getting on each other's nerves when we're confined to tight places is to be expected and normal. It's also an opportunity to look at the conflict that might not have been addressed under typical circumstances and address that. So with any difficult time, there's an opportunity as well as a challenge for us. These are drastic times, and they call for drastic measures. So this is an opportunity to also rethink family relationships and how people interact with each other. And we're in a mini laboratories in our homes typically to do that. Let me talk a little bit about couples. I've been doing couples therapy for 40 years. And when couples meet each other and begin a relationship, we look for similarities. So you might find someone that likes kind of similar movies. They like to take walks. They like to read. They like the same kind of music. They may have the same political affiliation. You look for things in common on the surface, and that's what really attracts people as you start to develop a relationship with someone. There's also another process that's going on through this, and it's less conscious. So you look for those similarities and are attracted to the person because of those. Underneath those similarities, people frequently select partners with complementary traits. So someone who has something to fill in that you lack, something to fill not a hole in you, but something you admire that you don't have as much yourself. So an example is someone who's very organized and very introverted may select someone as a partner who doesn't worry so much about details and is extroverted. So that works really well in the short term because you admire those responsibilities. You think, boy, I'd like to be more extroverted, and this person is going to help me to be more extroverted. And that works really well at first. One of the issues that can arise is over time, those things that you saw as complementary are now seen as different, and they can be annoying. So the person who was extroverted and really appreciated that in their partner now thinks, well, why are they trying to push me to do so many things and talk to neighbors or talk to friends or go out? So in the short term, those things are very positive, but be aware of that can be something that can really get on your nerves. Along with that issue is something that people try to do to cope with that. When they notice the behaviors and patterns they don't like, they tend to try to change them. We tend to see ways that others can improve and point them out. I don't know how much success you've experienced with someone who tries to change things you're doing, but it's frequently not successful. Trying to change another person usually frustrates both of you. So what I'm going to be talking about today are things that you can think about to look at your behavior and what you could do to change them, and ask you to think about what you're trying to do in family relationships when you try to change someone else's behavior. It's just usually not successful. So an example is if you think someone needs to, in a family member, in the family, spouse, kids, relatives who you're in close contact with, maybe needs to lose weight, or maybe their eating habits aren't the best. Usually you don't have much success by saying, you should lose weight. Why are you having a second piece of cake? Because you're trying to lose weight. That is usually not that successful. The person usually changes behaviors, as we all do, because we recognize that we need to change them. Frequently, people realize they need to change their behavior, so the person having that second slice of cake knows that that's not health-promoting behaviors. But they're struggling to find ways to manage that and address that issue themselves typically. Rather than look at that behavior, talk about how you feel. It might be that I'm concerned about your health. I worry about you. So those are I statements rather than statements pointed toward the other person. It's also, if you're looking at some resolution strategies, it's usually not helpful to also comment on the person's personality, but rather stay with behaviors. So rather than say, you're unreliable or you're dishonest, kind of global, blaming or summarizing statements Stay with how you're feeling about it, and the person's more likely to listen to you. When you point out a personality style in a person, that's usually not effective at getting the person to change. It probably shows your frustration more than anything else, and no doubt you're frustrated. I'm also not saying that if you say the person is unreliable, maybe they're really not reliable, but pointing that out in that direct fashion is just usually not successful in inviting change. And in fact, the person says, well, if I'm not reliable, you're overly conscientious. So you kind of get into that back and forth playing tennis. The one person says something, the other person says something. On the other hand, when someone's saying something to you, it's usually helpful to not automatically personalize things when the person makes a comment and interpret as critical. It may or may not be, but sometimes in close quarters, people can have their radar up and interpret things as more negative than they would normally do or the other person intended to do. Try to practice pause before reacting. That's pause before you react. Try to understand the other person's view and intentions, and you may need to ask more directly about that. In close quarters, usual coping strategies may not work. So the things that might usually work for you to diffuse tension and diffuse conflict might not work. You probably can't go out and do something. You may be able to take a walk, but seeing friends, talking to people about issues may not be as available. One of the strategies you can think about is to try something different and see if that works. So we all have patterns that we fall into. And rather than fall into that pattern, be aware of what you're doing and try something different. Trying something different may not work the first time. The point is to learn from it and then try something different again, to continue to try something different. And this may not work 100%, but again, incremental change is important and diffusing family conflict. So try something different. Try a different strategy. Try a new coping strategy because you can really only control your response. You typically can't control the other person's response to you. So the take-home message on this is control the controllable, which is really within this realm of your comments and your reactions to things. Another issue in dealing with stress is to take your anxiety temperature. This is a time when most people feel much more anxious. Anxiety and stress tend to increase emotional dysregulation when people's emotions get more out of control, and that can be related to underlying anxiety. Now, everybody feels anxious and scared in this pandemic. That's normal. You're in really good company if you wake up at 4 a.m. and start to worry and ruminate about your health, your family's health, and finances. How are we going to get by? What's going to happen to the future? How are we going to manage? We're hardwired to be anxious as human beings, and this has worked really well historically and evolutionarily to be prepared for the evil person coming out of the side or the tiger coming out of the jungle. We're wired to be sensitive and aware, and that's typically future-oriented. So some of managing this has to do with seeing how you're feeling, if you're feeling anxious, and what are those underlying thoughts. So if you're anxious and wake up and think, oh, what's going to happen if my family members get sick? I'm going to the store. What happens if we come back and somebody's sick? They'll spread it through the family. And sometimes your anxiety can be related to some of these thoughts. And these are essential components to cognitive behavioral therapy, where you can't change the feelings you have, but take a look at the thoughts and check how accurate they are. Sometimes people have thoughts that are inaccurate because, well, we've gone to the store once a week, we take precautions, we wear a mask. So in reality, what's the evidence for those thoughts? And frequently, there's not a lot of evidence for those thoughts, and they trigger a lot of feelings of anxiety. Another issue with families being in close quarters is we go about our business and just assume that even in this really difficult, strange situation, things will just work out on their own. We'll get by and we'll manage. So a suggestion I have is to have family meetings on a regular basis. This sounds often pretty strange to families. Many work environments, most work environments, have team meetings, staff meetings, where issues are discussed and plans are made. That's just part of how businesses work. So although family is not a business, it is a business of sorts. And having family meetings can be very effective in helping sort out roles and plans over the next week. So pick a time that's convenient for family members. Set some ground rules that there should be no name calling or blaming. Maybe a half hour is enough for a family meeting. And go around starting the family meeting and ask people for a win. So rather than start a family meeting with, well, I'm really annoyed because I can't see my friends, or I'm really concerned about my health, or I'm concerned about the number of people who are ill, start with a win. It might be small. For a teenager, it might be, I successfully logged on and got my homework done today. Or I had a really nice meal that you cooked last night. That took a lot of effort on your part, and that was really great. Or I stepped outside to take a walk really briefly today and noticed the trees were in bloom. It doesn't have to be a large, tremendously big win, but start with something positive and go around and have each person start by contributing something that's positive. So good emotional conversation can be best. Then you want to talk about some roles. So how are we going to live together? What roles or tasks will we have? What roles will family members going to have? Who's going to cook? Who's going to clean? Who's going to do the laundry? What personal space do people have? There are 3 of us and there's only 2 computers. How are we going to manage to share those? Who has what space when? And it's a way to kind of air out and resolve some scheduling and other issues that can prevent conflict in the future or at least decrease it. And then if you come back on a weekly basis and review that, I think that's helpful. Someone can even record that and write it down so you have a list of what family roles and issues are. When family members are in a confined, yes.
I'm sorry, I wanted to interrupt you real quick. I think this is something that we never thought about. I know from my own personal experience, but I was just looking at the poll, and the question we asked at the beginning, there's 66% of the people that responded have never had a family meeting. So I think this is something that, you're definitely touching on, that right now when we're all safe at home together, we can make plans like this. So I definitely think these are great tips. And I do want to remind our listeners, if you have a question you'd like to ask, please press *3 on your telephone keypad to be connected with someone from our team that can take your question right there. So back to you, Dr. Kalon.
Thanks. Yeah, I think a lot of people think, well, we talk all the time. We're in a confined space. Why do we need to have a meeting when we're all here? And I think that's exactly why it is wise to have a meeting and really encourage people to attend. If someone refuses to attend, you really can't force them. But I'd still have a family meeting and then share the results with them, not blaming them for not attending, but inviting them to attend in the future, even if they don't feel like they have a lot to add. But when families are in unconfined spaces, conflict is more likely to occur. That's unfortunately an artifact of being in a confined space. And it's how you manage and resolve those conflicts that's important. To expect not to have conflicts is probably unrealistic when you're in a tight space and people are confined. So it's how you resolve those. Don't keep things bottled up. It's important to express things as they come up and not just keep them bottled up when you can explode later. It also may allow you to be more direct and clear with communication. If somebody struggles with verbal communication, you can use other forms like writing or communicating in different ways. Another issue is that sometimes family members can get into conflict. So one of your family members can get into a conflict with another family member, and that's really difficult for everybody to see. There tends to be a tendency with some family members who see that to try to intervene and get in the middle of that, to try to be a peacemaker and resolve the issue. My suggestion would be to think twice about getting in the middle of conflict that 2 family members have. Frequently, you can get drawn into it. You can try to take sides. You can get pulled into it yourself. So I'm a therapist, and a therapist role is way different than your role in a family member. Family members really struggle to be good therapists because they're so emotionally involved with the situation. Now, that doesn't mean those two people are going to be able to come to a perfect resolution every time. Sometimes the best they can do is agree to disagree. So respect the other person's opinion and not expect a total resolution of it. But no, you're going to have a disagreement, and you're going to put that on the side for a while. Some other tips for managing conflict within families. Managing conflict can be addressed also by managing positive comments. Notice and comment on positive behaviors in others. Again, we're not hardwired to think about positive things. When our toe hurts, we don't think about how our back doesn't hurt today or we don't have a headache. We think about what the problem is, and we focus on that. And sometimes people can get stuck focusing on the negative behaviors and the negative things and not recognize the positive things. They're there, but people tend not to notice it. So it takes a conscious effort and practice to notice positive behaviors and reinforce and comment on that. But don't paint an overly optimistic picture either. It's got to be very realistic, based on strengths. Family members and families are generally very resilient, and you can play a role in helping to really, I hate to be manipulative, but shape behaviors by commenting on positive behaviors. Show interest in other people in the house. We can get so caught up on our own heads and our own worlds that we just can kind of focus on our own issues and move out of that. I think it's important to express interest in others and ask how their day is going, what they're doing, even if it may not be that grand or expansive if you're in the house all day. It's important also to allow other family individuals to have personal space. There's a balance between personal space and group space. But again, going back to family meetings, you can talk about some of those. But giving people personal space as well as inviting them into group activities. Teens have a particularly difficult time in this environment. Teens, the developmental task of a teenager or a young person is to move away from their family, to develop their own lives, develop their own identities. Frequently, this happens in the context of conflict. Sometimes teens don't leave the nest so easily. They need conflict to be able to separate. But their main job is to identify with friends and separate. And this runs completely counter to that, where the teen or young person in their 20s is back in their family when their entire world revolves around being with peers. So recognize how important that is. Might also relax some of the requirements or the social media issues, where if you think a younger person is spending too much time on social media, you might limit that in the past. Probably not the best time to do that. That was limited before, probably will go back in the future. Use I statements. I talked about this earlier. Rather than labeling a person as inconsiderate, say something like, I really feel like my feelings were hurt. That allows much more of a dialogue, or at least have the person explore that rather than be defensive about what you said. Listener, be a listener. One of my mentors in family therapy, Carol Anderson, liked a quote from Lily Tomlin, the comedian. And Lily was talking about someone she knew, and she described them as that they listened with the intensity that most people reserve for speaking. So most people are really interested in having the person finish what they're going to say so they can say something back again. And it inhibits your ability to really listen to what the other person is saying. So try to pay attention to listening to the other person. Humor, use humor, not laughing at the person, but try to look at some of the humor in the situation that's there. That can really help. Other issues related to anxiety are probably related to lifestyle and trying to manage your environment. So you've heard this many times from many people about the importance of balanced diet. the importance of maintaining some type of exercise, even if it's minimal. People may think about exercise as going out and running or going to the gym. Exercise can be walking for 10 minutes and stretching. Meditation and distraction techniques are something else that can be helpful. Again, many people, when we're talking about meditation, have the idea that meditation is setting aside an hour in a quiet room with no distractions and trying to have their mind be blank while they meditate. Honestly, that's unachievable for most people. The kind of meditation that is achievable are the time it takes to put something in the microwave for a minute, or brush your teeth, or something that takes 1 minute. There are lots of examples of verbal meditations that you can find on the web. Really short statements that you can repeat. These can be very powerful and very helpful, and they're very brief. So, for an example, accept life, accept this moment exactly as it is. Accept life, accept this moment exactly as it is. Or, be where I am, otherwise I will miss life. Be where I am, otherwise I will miss life. They're very simple, but they can be very useful for helping you feel grounded, even a little bit. Again, nothing huge, but small things that can add up and help. I think it's also helpful to stay in touch with what's going on with the virus, but not focus on it exclusively. Try to listen to radio or do something else that's distracting rather than spend a lot of time glued to the television or media reading about COVID. That's probably not going to be helpful. Some other things are to try not to be a cheerleader. I talked about positivity, but be realistically positive and focus on all sides. I talked about teenagers and their developmental tasks, and younger children have different tasks. Younger children frequently have anxiety, and it's important for you to manage some of your anxiety to be able to be realistic and reassuring with children. They also don't typically, or they might not express anxiety the way an adult will. So you know if you feel anxious, and somebody's going to tell you if they feel anxious. Kids frequently have different ways of expressing that anxiety that doesn't look like anxiety. It could be in a behavior problem, or acting out, or physical symptoms, or anger, or irritability, or fatigue, avoidance, isolation. Those might be symptoms that the child is really feeling anxious, and to explore that whether the child is feeling anxious other than that, rather than to react to their behavior, which might not be the real issue. It might be under that. The last thing I'm going to talk about is a concept called radical acceptance. And again, you can go on the web and look at radical acceptance. This is one of the skills taught in dialectical behavior therapy, a very popular therapy that was originally developed for individuals with a certain type of personality disorder, but it's very useful for a much wider audience. And radical acceptance is different than just accepting things. It's radically accepting things. We're grounded to like or not like our current situation and what we're dealing with. So we just react to our current situation. And it's suspending your reactions and radically accepting what's going on right now and not trying to fight it. It's letting go of what you want and accepting what you have. And there are three parts to that. It's accepting what reality is. It's accepting what events or situations cause the pain or discomfort. And then it's accepting that life can be satisfying, even with painful events. So rather than to be annoyed or angry at your anxiety, and that's not going to be a successful way to change your anxiety, it's accepting that you're anxious now. That's different than saying, oh, well, I'm just fine being anxious now. No, it's not. It's where you are right now, and it's accepting that while then trying to change that and find some strategies to manage it. There are lots of other good skills in dialectical behavior therapy that can be used, that can be found online. Let me mention one more thing, and this has to do with intimate partner violence. intimate partner violence or domestic violence is entirely different from the issue of conflict. Intimate partner violence is not usual conflict that's experienced in a family. If you or a family member or partner are experiencing any intimate partner violence, the recommendations I went through really don't hold and are not appropriate. It's not the victim's fault and can occur across all demographic, economic, and racial classes. If you find yourself in the situation of intimate partner violence or feel unsafe at home, please reach out to resources available. And I think the concern is that being confined, these issues may be more prominent. So thank you very much. And I think really the goal of this experience is that we'll all get through this together and not just strive, but learn from it eventually and thrive.
Thank you so much, Dr. Kalon. I want to take a minute right now for our listeners. One more poll question. Will you use any of the resolution strategies that you learned today with your family? Press 1 for yes and press 2 for no. The question is, will you use any of the resolution strategies you learned today with your family? Press 1 for yes, press 2 for no. If you're watching and listening on our online forum, you can vote there as well and be counted in the poll. And again, for our listeners, if you have any more quick questions, you can press *3. And the information we have on our website, we have a wealth of information for community resources, personal counseling, caregiver counseling, and additional support. And the website is upmchealthplan.com/in-touch. That's upmchealthplan.com/in-touch. And if you have any questions or need something specific regarding the COVID-19 virus, there are resources available at upmchealthplan.com/COVID-19. And we also want to remind you to tune in this coming Thursday at noon. We will have Dr. Michael Parkinson, who's a preventive medicine expert, and he will discuss how healthy eating can prevent, treat, and reverse common medical conditions. It can even add years to your life. Janine Jones will join him, and she's a health coach for UPMC Health Plan, and she will share how a health coach can assist you and how a personalized app can support healthy eating, weight management, and physical activity. So I see, Dr. Kalon, we do have some questions and some comments that have come in. I'm not sure, there a few people are asking for copies of the exercises that we did last week. We can provide those to you. You did leave us your name in the comment box. And if you want a copy of these slides, you can certainly get a copy of those too. If you want to give us a call or call member services, they can assist. We had a couple of statements about folks that live alone. I didn't know if you wanted to comment on some strategies that they might be able to, to stay engaged with their family.
Yeah, I think it's important to remain engaged. It's particularly difficult for people, I agree, who live alone because you are confined. Trying to really reach out and stay in touch with family members is really important. I think sometimes people also feel that they don't want to burden family members, and they don't want to have family members worry about them. So people can get caught not reaching out enough because they're worried. They'll think I'm here alone and worry about me. Well, they probably are worried about you, and there is something to worry about because it's a concern that you're alone. Also, to try to develop routines as much as you can to have a structure yourself, so you get up the same time every day and have activities that you can participate in or be involved in every day, a routine about reading, watching television, meals at regular times. Journaling might be helpful also for people. It can help you reflect on some of the issues you're dealing with and kind of some of your own experiences, and that may help you to kind of understand that a little bit better. Unfortunately, living alone, there are few things you can do to manage that if you're very active and would typically get out on a regular basis. So doing that virtually is the next best thing, and not feeling like you're burdening family members, but that it's important to reach out to them or friends.
Thank you. That's very, very important point. We did get quite a few comments about folks living alone. So I do believe myself personally is that having that structure and that routine, because we're so off of our routine, and I have a teenager and a pre-teenager at home, and we had to rework our routine, which has definitely helped a lot. So I really appreciate your time today. We're getting close to the time. I see there's a couple more people that are in the screening box, so we can leave this open for that. But if at any time you have any questions for us, UPMC Health Plan is here for our members. You can share these live talks with your family and friends. They're not just for members. This is something we want to, these tools and the resources that we're providing are helpful for everyone in the community. And we just want you to know that we're all in this together, and we are here for you for support as your health plan. And we appreciate all of the time that Dr. Kalon has put towards this talk today. Do you have any other comments you want to make, Dr. Kalon, before we sign off?
I think my final thing is just a challenge, because we're looking now at the difficulties we have and how challenged we are about things. So my challenge to people would also think about finding the components of this that we can use for the future, that we can think about in ways that we can manage and learn from this from a personal perspective.
Great. Thank you. And again, if you have a question that has been screened, we did not address it online today, we will have someone follow up with you either today or sometime tomorrow. We're trying to get back to all of those questions as soon as possible, and we will look forward to having everyone join us again this coming Thursday at noon to listen about food as medicine. Thanks again for your time, everyone, and have a wonderful day.